Review of Literature, Increasing Patient Satisfaction by Joan Wilson. Presentation objectives. Articulate the importance of patient satisfaction. Discuss 3 ways to monitor patient satisfaction. And describe 3 ways to improve patient satisfaction. Improving Patient Satisfaction through Physician Education, Feedback, and Incentives by Banca et al. Describes an intervention program they used with interns to improve HCAHPS scores. Similar programs could be used staff-wide in hospitals. This education and incentive program can be tailored to fit specific target groups. Madar's article about improving the quality of tourism services focuses on a broad group of customers from all over and how to increase satisfaction. The findings discussed include things that create patient satisfaction in any business, such as courteous and competent staff. Though total quality management is not a new concept, Nguyen and Nagase discussed its impact on customer satisfaction. The authors discuss the increasing patient demand for high-quality service. Plageson and Mao indicate the need for services to change and adapt to patient needs and wants. Technology is changing continuously, and offering the most up-to-date options for clients will improve customer satisfaction. The medical field caters to patients from birth to the end of life. There typically is an increase in health problems in late ages, leading to a large portion of patients being geriatric. This article describes what senior living community residents value and the surveys they use to measure their satisfaction. The last article listed discusses the relationship between patient education, patient empowerment, and patient satisfaction. Hospitalization can be very difficult and emotional for many people. Training staff to properly educate and assess the knowledge of patients, as well as how to empower the patients, can improve the patient's sense of control and health outcomes. Patient satisfaction has become a goal for medical services as competition grows. In the United States, the Hospital Consumer Assessment of Healthcare and Providers and Systems, HCAHPS, is a standardized survey that reflects the patient's views of their care at hospitals. The data collected from these surveys is made public. This information gives hospitals knowledge of the areas they need to improve and creates accountability. According to Medicare.gov, 38% of patients nationally would not recommend the hospital they visited. With so much information available online, hospitals want to keep patients satisfied. Hospital reviews are available to everyone with just a few keystrokes. Quality-focused strategy increases competitiveness. One study on senior living communities found that the more satisfied its residents were, the more they recommended the community to friends and family, therefore increasing business. Measuring patient satisfaction. Patient satisfaction can be monitored and compared to state and national standards by reviewing HCAHPS scores. Internal hospital surveying can be done to find areas for improvement hospital-wide or by unit. Committees can be designated to specific areas in need of improvement for monitoring and strategizing. Creating patient satisfaction. Focus on nursing excellence, noted by obtainment of magnet status by a facility, correlates with increased positive care experiences by patients. Having happy, well-trained, and educated staff caring for patients increases patient satisfaction. Patient satisfaction has been linked to positive patient experiences. The clinical effectiveness, adherence, health outcomes, and safety of patients have been positively affected by positive experiences. Nguyen and Nagase found that the total quality management, TQM, has a significant influence on patient satisfaction. TQM includes keeping staff trained and knowledgeable and improving the customer experience. Assessing patient needs and wants and adding new services to better fit the needs of patients and the community could help to improve patient satisfaction. Flegeson and Mao discussed how a mix of virtual visits and office visits had a higher rate of patient satisfaction among obstetric patients. Providing current technology, testing, and treatment options allows for better patient care. A study by Ye and Wu and Tang found that patient education and patient empowerment were linked to patient satisfaction and discussed the need for training staff in patient empowerment. According to Medicare.gov, 47% of patients did not understand their plan of care when they left the hospital, and 34% claimed meds were not explained prior to administration. Patients were less satisfied when they feel they have no control or understanding. Leading the way. Educating and involving staff in the plan to increase patient satisfaction will lead to better outcomes. Staff members work closely with patients and can be a critical part in discovering ways to improve patient satisfaction. Positive reinforcement can be used as an incentive when outcomes are met. Satisfaction should be continuously monitored and reevaluated. The healthcare field is continuously changing, as are community and patient needs and expectations. This process will not simply end when the scores improve. Continuing the process is important to maintain patient satisfaction. This concludes my presentation. Thank you.